Hello and welcome to this section on skin tears management and prevention. Apologies about the first picture, but we know it's only going to get worse from here on in. So, before we start about skincare, let's just think about some things. So, do we think it's true or false that skin tears occur mostly on the lower extremities? Do we think that being immobile increases the chance of skin care? Do skin tears are stages like pressure ulcers? Nutrition and hydration play a role in the prevention of skin tears. Protecting a peri-wound skin is an important step in the treatment of a skin tear, and the maximum wear time of Tegaderm absorbent clear dressing is 7 days. So let's have a look. Skin tears. As a healthcare professional, many of us understand the ongoing challenge of skin tears. They are painful and often difficult and lengthy to treat. They can become infected and cause stress and anxiety to parents, to patients and their family, as well as their caregiver. Even more frustrating, they're largely preventable. Previously, there was little clarification to preventing in the prevention language in place, in part due to the lack of evidence and knowledge. In 2011, world experts came together and developed a common language which has given us a treatment and strategies for skin tear. A skin tear is a specific type of laceration that is most frequently occurs in older people, according to the 2011 census, developed by documental skin tear Kim and Sharon. A skin tear is defined as a wound caused by a shear, friction, or a blunt force resulting in the separation of skin layers. A skin tear can be partial thickness, the separation of the epidermis from the dermis, or full thickness, separating both the epidermis and the dermis for the underlying skin. So the definition that we're looking for here under a skin tear is a wound caused by a shear, friction, or a blunt force resulting in a separation of the skin layer. What's more important is to understand that the skin tear can be partial thickness, so it can just be the top layer of the skin folding back, to a full thickness, to the separation of both of the epidermis and the dermis from the underlying structure. So when we talk about shear and friction, we're talking about people with poor moving and handling techniques where they're being drag lifted up a bed or using the wrong moving and handling equipment. So for example, I've seen a lot of time people using towels to move somebody up and down the bed, and that's going to cause shearing and friction, or by a blunt force. So that could be, again, another skin tear I saw once was on a kick plate of a wheelchair, and the kick plate caught the back of the leg as a blunt force and sheared the skin, or separated the skin, I should say. So skin tear prevalence, studies show that skin tears may have a higher prevalence rate than pressure ulcers, and as much as 41%. So again, this comes from the fact that the prevalence on that pressure ulcers, there was a strong statement given that forces the attention on the healthcare system given to pressure ulcers. Research and works such as the 2011 census documents of Canada of wound care and best practice recommendations for the prevalence and treatment of skin tears are helping to provide a structure and guidance for the prevention and management of skin tears. So what we're saying here is they're 41% higher than pressure ulcers because we understand our duty and care around pressure ulcers. We understand that they're enlargeable, preventable, but so are skin tears, and that's what we're saying here. So if we look at some of the population then around that, we're obviously aware that it's more common in the elderly population. And that's simply because we looked earlier at the skin. We know the skin on an elderly person is a bit thinner, the collagen's gone, it starts to wrinkle, it's dried out, it's lost its elasticity, and therefore it's easier to tear and rupture. 1.5 million skin tears occur a year in adults in the healthcare facilities. I think that's much higher than that. I don't believe that to be a true figure at all. I think that's not even, that's the bottom of the iceberg. That's only what's recorded. Most common in the upper extremities, so 50% without apparent cause, 25% from wheelchair injuries, and 25% from bumping into objects. So again, those 25% from wheelchair injuries are definitely avoidable. And again, going back to that example I gave about the kick plate, it was a real obvious moment of stupidity. When someone's kicking a kick plate, you're going to catch somebody's leg in there. So again, there's a strong focus for our attention around pressure ulcer prevention. Research has done showing that we need to do further work in a reduction of these incidences. Now, we've already seen the aging skin in the previous wound modules, but again, just to remind ourselves here, you can see the epidermis, the top layer there, it's lost its hydration. It's not as, its elasticity's gone, its collagen's gone, it's a lot thinner and far more at risk of tearing. So, common factors then, we know aging is a common factor. The epidermis, if it's thin, that's one. So skin has less elasticity and it's dry. The subcutaneous tissue loss, so underneath there isn't as much flesh there for it to hold on to. The decreased barrier of friction and sensitivity and pain, so they can't feel it. So sometimes the skin will just pull back. They haven't felt that skin pull back, and therefore there's a real problem there around infection because sometimes they go unnoticed. Blood vessels become thinner and more fragile. So again, they can bruise quite easily and rupture. And again, 20% loss in the dermal thickness. So here's some facts. Did you know that the skin ages, the epidermis thins, skin has less elasticity and is more dry? The epidermis' primary responsibility is protection. It's responsible for managing skin's integrity against shearing, friction, and toxic irritants. Also, our skin loosens some of its barrier fractures and sensitivity. It's also less able to regulate our body temperature and feel pain. The blood vessels become thinner and fragile. Up to 20% of the dermal thickness is lost. However, we must remember that even young people and mobile patients can develop skin tears. They may have an edema, fragile blood vessels, or other risk factors. So therefore, we must document, regardless of the definition of skin tear, common occurrence of the extremities of ages on critically ill or medically compromised people. And therefore, we need to make sure all that receive personal care are looked after properly. Now, we've seen this layer of skin previously, but just to remind us, we've got the epidermis, which is that first millimeter of skin. We go down to the dermal and epidermal, so that's the next layer down under the skin. We've got the dermis, and then we've got our subcutaneous tissue. I don't know why that says the layers of the sky, that should be definitely layers of the skin. Now look at the diagram of the layers of the skin. We discussed how the epidermis is thinner and in the mature skin as it thins. The epidermal junction flattens. This is about the flattening of the two egg cartons together. As you put them together, cup to cup, they will stay stronger and it's more difficult to move. But if you pull them together, cover to cover, the smoother surface slides. Therefore, as the junction flattens out, the skin is more at risk of tearing as the ridges do not adhere well. The junction also develops an immature skin, such as premature infants. So we're caring for at-risk individuals. Many daily activities, such as bathing, dressing, and toileting, can increase the potential cause of skin tears. So what we're saying there is dressing people, rolling things up can just cause those skin tears. Studies have shown evidence of identifying at-risk individuals and following preventive programs will decrease the incidence of skin care. So going back to prevention is definitely a factor here, something that we can definitely do. So what we're looking at here is the skin tear classification system, so the ISTAP. the International Skin Tear Advisory Panel. So they've put this into 3 types. So type 1, no skin loss. And in this picture, you can see that maybe what's happened is they banged it, maybe on a side, the skin's rolled up, but it's gone back down. Again, we've got the ruler there measuring the length of it, and obviously when that skin tear happened, we've got the date on there. So it's the linear or flap tear can be repositioned and covers the wound to the bed. So that's a type 1. In 2013, the International Skin Tear Advisory Panel, also known as the ISTAP, created a toolkit for the prevention, identification and treatment of skin tears. The classification system of skin tears was widely used since 2013. Under the new ISTAP classification system, skin tears are classified as type 1, 2 and 3. So the picture that we've just seen there depicts a type 1. So using the same assessment, this is now a type 2, and this is a partial flap loss. So this is where the skin's gone back and it can't be repositioned back over the wound. So that's a type 2. And finally, the type 3, that's where you've lost the flaps, exposing the entire wound bed. So prevention is better than cure. Skin tear prevention. So here we've got a pathway to assessment for treatment of skin tears. And the diagram shows the pathways provided by the Canadian experts in a journal. And what you can see here is we start at the top with a person with skin tear, and we look at the treatment, treat the cause. So hydration, nutrition, prevention, control, good skin care, adapt to safe environment and educate staff. We've then got our local wound, and we'll talk about that in a second. And then we've got patient-centered control, so quality of life, pain control, and education to client and family. As we go down, we've got the debridement, so non-visible tissue only, avoid sutures and staples. We've got the inflammation and infection, so topical antibiotics, local infections, antibiotics for deep tissue infection, tetanus and immunization. And we've got the moisture balance, looking at non-adhesive, low track, removal of barriers, those different films, avoid tape and use and skin glue. And non-adhesive edges, reevaluate and consider different dressings. So here, when we look at that, we've got a pathway for treating skin tears. Now, we've also got the algorithm here. So the skin tears algorithm was designed to assist healthcare professionals in the assessment and treatment of skin tears, and to complete the pathway of the assessment and treatment of skin tears, and to assist in the skin tear classifications and wound assessments. The algorithm is to be continually linked between assessing and treating skin tears. So at the top, we've got the tear, we assess it, we control the bleeding, we go to the cleanse, so cleaning it, approximate wound edges, so looking at the measurement and classification, so stage 1, 2 or 3, and size. We're going to look at the goals for the treatment, which is to treat the cause, implement prevention protocols, as we've just discussed. We're going to look at moisture and wound healing, avoid trauma and protect the skin, and we're going to manage the areas, avoid infection, and look at pain control. And again, using those 3 types, we've got a very clear identification system of skin tears, so type 1, type 2 and type 3. So when we choose the dressings for skin tears, we need to think about the recommendations that we've already got. So we need to maintain constant moisture. Does it suit the location of the environment? Does it protect the peri-wound skin? Does it control and manage the exodus and the stuff that's coming out? Does it control and manage infection? And does it optimize care given time? So again, sorry, dry mouth. Once again, the ideal dressing will be maintained at an appropriate level of moisture to suit the local wound type environment and protect the perinatal skin. So here you can see this is a skin tear. It looks like a stage 1 because I think we can see the skin flap still there. He's obviously banged it on his bed, or I'm saying it's a he, but the person looks like they've banged it on the bed and that's caused the skin flap to go back. And here the 3M Tegaderm absorbent clear dressing has been placed. So the Tegaderm dressing will maintain that moisture in the skin, naturally helping the skin to form back and to heal around and to help with that healing process. And again, on this patient's arm, you can see it's quite dry. So again, definitely at risk. So if we know this person's elbow is at risk of being banged or causing further skin damage, we need to be thinking about care planning on how we can avoid that in the future. This one looks more like a laceration. So again, for type 2, the skin flaps have gone back, definitely more difficult for it to heal. And again, another type 2. And you can see the contusions around. So you've got the bruising going on around here. And what's important is to maintain the infection control side and to make sure that it's all looked after. And again, that's your stage 3. So there's no flaps. We've just got raw edges all the way around. So hopefully that gives you an idea about skin tears, how to classify them from type 1 to type 3. And again, just thinking about cleansing them with the appropriate cleansing methods. And again, looking at the appropriate dressings for skin tears and thinking about infection control. 3M, who is a provider of dressings, do free training online on their products. So it's always worthwhile if you want to know a bit more about dressings. If you go to the manufacturers like 3M, they will offer free training online via their websites. I hope you found that useful on skin tears. It's a real common problem. We know 41% higher than the pressure ulcers. So definitely something worthwhile for you all to keep an eye out for. Anyway, thanks for watching and I'll see you in the next video.